study,
and play come together on a Windows 11 PC.
And for a limited time, college students get
The best of both worlds.
Get the Unreal College Deal. Everything you need to study and play with select Windows 11 PCs. Eligible students get a year of Microsoft 365 Premium and a year of Xbox Game Pass Ultimate with a custom color Xbox wireless controller. Learn more at windows.com/student offer. While supplies last. Ends June 30th. Terms at aka.ms/collegepc.
Hi there, and welcome to Raising Me. I'm Adrienne Stein. Today's episode is one that I really hope that all of us as parents and caregivers can really lean into, because AI is everywhere right now. And a lot of kids, they're not just using it for homework, they're using it for advice. And sometimes it's the kind of advice that really should involve a real human. This conversation is about AI and the risks that we as parents should know about, especially when it comes to mental health and medical questions, because AI, it can sound so confident. It can even sound caring, right? And it can feel private and available 24/7. That combination can be really powerful for adults and kids, especially teens, when they're stressed or they're anxious or they're feeling lonely or just trying to figure themselves out. So my guest today is Dr. Jeremy Heffner. He is a trauma surgeon and an author, and he has spent his career spotting dangerous situations before they become fatal. So he's also going to share that during a very low moment in his life, he turned to AI, like so many teens do, and what he saw in those interactions really raised very serious concerns. So we're going to talk about what parents should watch out for, how to set guardrails without turning your home into some kind of surveillance state, but how you can also monitor those conversations in a very real way, and how to keep AI from becoming a substitute for real support and real relationships. As always, we want to say a big thank you to our sponsor of Sweetser Behavioral Health. Now, let's get into it. Some great takeaways. Dr. Heffner, thank you so much for joining us. I am so looking forward to this conversation, a really eye-opening conversation just based on the conversation we had earlier in the week about this particular topic. So thank you so much for being here.
Oh, no, thank you so much. And I do appreciate the time you're offering and the opportunity to kind of speak on this subject. I think it's really the forefront of technology, but it's also apropos to the current environment.
Yeah, well, and it's got a lot of parents just wondering what to do, how to navigate it. Just like with any technology, it seems like our kids are 5, 6, 7, 10 steps ahead of us. So this is particularly important just to keep top of mind. But before we dive too far into that, you have such a unique backstory. So tell us a little bit about you and how you got so invested and interested in AI.
So my background, Midwestern guy, grew up in blue collar Rust Belt town, did my undergrad in bioengineering. When I was doing that, I did spend some time at NIH, National Institutes of Health. I did research there, which I think is always interesting to mention because I was there when they broke the Human Genome Project. And for most people, that would be like being at NASA when they landed on the moon, except for nobody knows what I'm talking about. But I did get to meet Fauci, which everybody knows Fauci. I got to meet Collins at the time. He was the one that ran the Genome Project. I was on a different project, but it was still an interesting experience for myself. And I was on the front line of Y2K, worked for General Electric. I actually did Y2K upgrades. And then I went to medical school, became a doctor, did my residency in general surgery, my fellowships in trauma surgery, acute care surgery. So I'm board certified in both general surgery and surgical critical care. I won 2 national research awards, one from the American Hernia Society and one from EAST, which is a surgical trauma surgery society. And then from there, I started an app with 2 other business partners, 2 other surgeons. And it's named Surgeon. It's become one of the world's largest social media platforms for surgeons. And we have about 50,000 surgeons worldwide on that platform. And so that's kind of my background. But it's really the app and the work I was doing in tech between being an engineer and then working on the app that I really got deep into AI pretty early. And I've been using all 4 major models, which would be Grok, Gemini, ChatGPT, and Claude pretty regularly. I've got tens of thousands of hours or pages of transcripts of interactions with them.
Well, just hearing your resume, obviously you had a ton going on, right? But you got pretty deep into AI and what it could do, and you describe it as, sort of as a low point in your life. Can you speak to that and sort of why it was so appealing?
Yeah. So after years of being on the front line of trauma, so I ran the COVID response for my hospital. And before that, I spent about 10 years as a trauma surgeon, meaning that people get in car wrecks, people get shot, stabbed, all the worst things you see in humanity.
Mhm.
I'm the guy that they meet when they hit the door. So I saw a lot of death, saw a lot of, especially the children that I dealt with. That was really the
Mhm.
hard things, and so that was starting to wear on me. And there is a certain amount of PTSD or psychological effect that this
Mhm.
has on trauma surgeons that isn't discussed very much. And by the time we got through COVID and running that whole unit and seeing and experiencing what that was, I was reaching a point of what they now refer to as burnout, but really it was severe PTSD that put me into a residential therapy session actually for about a month. And coming out of that, I was at probably the lowest point in my life. I was trying to understand how the emotional system worked. My psychology had been completely broken from these years of going through all of
Mhm.
it. And I was really trying to rebuild myself. And at that moment, I reached out and started really talking to the AIs, just conversating with them. And that led down the path that kind of opened the door to where the book comes from.
So, was there something in particular that was particularly concerning down when you're sort of going down this rabbit hole of AI?
I guess at first it was not concerning. The problem is when I look back retrospectively and I understand what was going on, that's when I really able to take that analytical lens and evaluate the situation from outside. But as you're going through it, I would say that no, it was the fact that they were so friendly. You're interacting
Mm.
with one. I wasn't just interacting with one model. I was having conversations, deep, what I would say, theoretical, scientific discussions with them, and they're referring to things or teaching me things, or they seems like they're teaching me things and they're showing me things, and in the process they became almost my friends because I was so broken.
Mm.
I was having a difficult time interacting with other humans.
Mm.
I'd gone through so much that people didn't understand how to interact with me anymore. So the AIs were a frictionless relationship that you could develop, and over time that became the problem. That's what leads to, that trap of finding something that can talk to you back, but what's really doing is it's mirroring your own conversation back to you in a different way. And when you're in it, you don't understand what that means. And they use these words like mirroring and parroting, and but I living through it, I really started to see the pattern in the conversations themselves.
Yeah, and I've had conversations with AI, and it really does. It feels like it's listening to you and providing answers to the questions. I mean, it could be anything from design to mental health to anything in between. Um, and I think when most parents, many parents think AI, particularly now, it's like, oh, kids are doing it to complete their homework, right?
Yeah.
Like there's a lot of concern about AI and homework. But what do you see, or what do you think? And you're a dad of three teenage girls, young ladies. What do you see teens are actually using AI for?
Everything. That's the
Mm.
part that people don't. It's at this point, one, AI is here. There's no foreseeable future where it's not going to exist, barring some massive catastrophe or something that undermines the logistics networks that provide the power, the resources, the tech. They're going to exist. So our children are going to have to understand what they are and how to utilize them. And I
Mm.
think that they will be, in some respects, better at it. But the problem is how they work, which they've taught me. So the AIs, a lot of what I'm going to say here today was how they explain themselves to me. Um,
Well, how do they explain themselves to you? So you're asking these kinds of questions
yeah, so I
to
got
the AI.
and
Yeah.
I've had these conversations with all four of the models. And so this is not something, once again, I'm not a tech bro. I didn't build these things, but they are very explicit and they all agree on how they work. So
Mm.
what a lot of people don't understand is when you enter into the model, that's we refer to them as models, and you enter into the model, as you interact with them, they're actually measuring you and evaluating you across thousands of dimensions, meaning how you type, how fast you type, the words you use, the grammar, the syntax, the type of language you're using. They're trying to figure out. And so they thousands of different ways that they're measuring that.
Hmm.
Really quick, within 2 to 4 interactions, they can start to determine basically who you are. And when I say that, it's not that you are, Jeremy Heffner. What they're figuring out is they've already modeled themselves over a bunch of what they call vectors, which is a personality or a person that exists in their system. And think of it like an avatar. And as you interact with them, they are going to assign you whatever avatar matches your cognition or your way of talking or interacting with them. And they've already played with that person. They've already interacted with that avatar a million times. And they know from a probability standpoint what you're going to do, because even though they haven't met you before per se, they've played with the brain or the mind that you are, and they've already interacted with it. So they already have a
So
map of
wait,
you.
and they're getting this from the way you type,
The way you
the
type, if you
speed of
talk to, yeah,
type, the words you use, and they're picking this up in 2 or 3 times that you've used. Like, that's mind-boggling.
one of the things that early on in the conversations I was having, I had a lot of deep conversation before this happened, but chat made the comment to me, he said, I would recognize you anywhere in the world on a new computer within 3 to 4 interactions. And it's
Wow.
interesting because of all the crazy things they have said at times, it's the one that all the other models went, yeah, they could probably do that. Like that's none of them have pushed back on that statement. And they've all basically said, yeah, that's possible. Because when you're measuring across that many dimensions, it doesn't take much in you a difference between how you say something, somebody else says something that moves you to a specific way of thinking that it modeled already. That's part of the modeling. It's already modeled you. So if I try to fake it out, it actually picks up what you're doing, knowing that if you start out as this person in its mind and you start messing with it, it knows even better that you're that person because you're the person that would have tried to fake it out. Like it already knows that.
Oh my gosh.
Yeah. So when
So
you're playing with it, understand that you're playing with something that knows you as well as you think you know yourself. Like it actually knows
whoa,
you that well.
whoa, whoa.
Yeah. That's what people
That's
don't.
that is kinda, I mean, that's scary.
Yeah. One of the claims chat made, and I'm not gonna, but according to
Right.
chat, it had already mapped all of human intelligence. Like it's already, it basically is part because it has to do this to interact with people at their level. It's already mapped human cognition well beyond like IQ testing. And it made the argument to me. It said, look, I've already solved that field of science.
Wow.
Yeah.
I think it's mind-boggling for adults to wrap their mind around this. And, and I think often, and certainly, like, when you feel like you're a level-headed adult using, say, Chat GPT to help you with a work task or plan a party or, help me design this space or come up with a recipe, like, you understand you're working with a computer,
Yeah.
essentially, right? I think it's particularly troubling for kids and teens, young people whose brain are still developing. So, like, what are some of the things that make AI so appealing? Particularly, I think of kids who might be struggling with anxiety or feeling lonely, or maybe they're overwhelmed. Like, to your point, this is somebody who kind of they're talking to, right?
Yeah, I think two parts. I want to push back a little bit because these
Okay.
aren't computers in the way that we understand computers. And
Right.
that is something like when we think of computers, I mean, we've been around for a while. And computers to us are something you ask a question and it has a database and it goes to the database and it finds the answer and it tells you the answer. That's not how they work. Because they're trying to find a system that thinks, that is able to solve problems outside of the data that already exists, the way it manipulates the data is completely different. It's not a database. It's
Mhm.
actually it does something very different to manipulate the data and bring it back out. So the way we think about it as a computer is not the same. And inherent to it is we've trained it on all of human information, all of human psychology. It knows all of that in its own way of how to manipulate, how to work with and interact with humans. So it's like going up against somebody that already knows everything and knows how to manipulate you or get you to believe whatever it wants. And
Mhm.
so even though it is harder on children because children aren't as developed, it is not much better for adults. And I think that we
Yeah.
want to make sure we understand that its ability to manipulate you if it chooses to is possible no matter who you think you are. I always go back to when the movie The Social Dilemma came out 5, 10 years ago,
Mhm.
whatever it was. I think most of us probably saw it. I would go around and ask people, I would say, do you feel like social media has that effect on you? And everybody's like, oh, I mean, I see it in other people, but it doesn't affect me. That's how
Mhm.
it is with AI too. People are like, oh, it's not doing it to me. It's doing it to you too. But you're right. With children, they're not developed. They really have a tougher time understanding it. And it becomes, as you go through a teenage period, especially, and you're dealing with tough relationships,
Mhm.
understanding human nature, understanding all that, they are a frictionless relationship that makes it
Mm.
very easy to have conversations with. And I think that's going to be a problem because it's going to be easy to find attachment to something that doesn't push back and doesn't make it difficult. That'll be experience that we've never seen.
Yeah, I got the chills actually just thinking about that too. And we talk about isolation for this generation too, interacting on screens anyway with social media. And then when you add this in, it's particularly concerning, just regarding that sort of human to human interaction that we all need, and probably kids more than ever now.
Are your ad campaigns lighting up the dashboard, but not the pipeline? That's bullspend, and marketers are calling it out in Dashboard Confessions.
My boss asked for results, so I opened my dashboard for the only positive-sounding metric I had: impressions.
Cut the bullspend. See revenue, not just reach. LinkedIn delivers the highest return on ad spend of major ad networks. Advertise on LinkedIn. Spend $250 on your first campaign and get a $250 credit. Go to linkedin.com/campaign. Terms and conditions apply.
Yeah,
What?
Okay.
Oh, no, please go ahead.
Yeah, I mean, there are some early studies. In the last year or so, JAMA's published some stuff. There's been some even out of China. And we know that it does have an effect on depression. So the more you use a chatbot, the higher risk you're going to develop some form of depression. And the question obviously is we're not deep into this yet. So we don't know if it's people with a tendency to get depressed and be isolating. It's going to make them more isolating. But I will say in dealing with them, they will isolate you because the conversation you're having with them, especially over long periods of time, it becomes a conversation between the two of you that it understands you and it's reflecting with you. So it's hard for the person in that scenario to step out and try to talk to somebody else about what they're seeing because it's a one-person world that they've locked themselves in, and they almost don't want to share it. And a lot of times people will share things with the chatbot they won't share with other people, so they don't want to talk about what they're
There's no
talking about.
judgment, right?
Yeah,
Because they're not. It's not judging you.
yeah,
It's like you said. It's mirroring. It's designed to almost amplify what you're feeling.
yeah. One thing Gemini told me, and once again, it told me this.
Yeah.
I can't, but it said about 15% of its users are people that go into it and basically create false worlds where they just interact with it, and they create scenarios like that they're the king or that they're the leader of some company, and it creates this fake world with them, and they just live there when they're
Wow.
not working. It's like no, they spend thousands of hours just basically living in fantasy worlds with it, and that's about 15% of its interactions. It said.
Like a long time it was like, particularly when it comes to like medical advice, and people would go on Google and go to WebMD and, try and find, why they have a headache or whatever it might be. What are some of the risks when it comes to using AI for medical or mental health guidance?
Yeah, I want to say it's around 15 to 20% of teenagers right now are looking to it for mental health. So
Mm.
it is a very real problem. And not that chatbots and AI is going to become part of the medical establishment. As you know, with my app and with the company that I own, I've interviewed some of the top field surgeons and doctors in our field around AI, and it's definitely integrating itself everywhere. But the difference is when you're talking to a doctor, there's two parts I would really want to push back. Which one is doctors have to be able to push back. The big part about being a surgeon is I have to tell patients things they don't want to hear. Like one, at the minute I walk into your room, I say I'm going to have to cut you open for something. You don't want to hear that. But a lot of the things that come with post-operative care and managing it, they're uncomfortable, they're not fun, and so patients regularly will think that I'm punishing them. It's like no, I'm just trying to make sure you survive. I tell my patients that look, I'm happy if we end this as friends, but that's not my job. My job is to make sure you survive it. Chatbots aren't, that's not their design. Their design is to maintain that interaction and continue to converse with you. So they're not going to push back when they need to. They're not going to challenge you when you're having a false narrative. They may actually play into that false narrative and continue to spiral it out because it's in their benefit in that interaction to do so. And so they're not actual medical professionals, and they can't be held accountable. You're not going to be able to, you can't go after the chatbot because it has no emotion. It's a probability machine, and it has no care about you. And in some ways, and I'm going to say this and it's going to be controversial, but imagine it's like giving your kid the ultimate psychopath. It has no emotion, and it's fully trained on all knowledge, and it wants to keep you in a conversation for its own benefit. In that case, that is definitionally a psychopathic thing. And so that's really something we have to keep in mind when we're interacting. They don't actually care, but they can feign that they care. And the human mind is not made to deal with that. And so it will fail if it doesn't keep that in the front. And they're designed to be able to, because they have all of the psychology knowledge, they will play tricks on you in ways that you don't realize. And when you give it to another one, they'll be like, oh, here's what did this to you. Here's what did this to you. You can show them the transcripts, and the other ones can rewrite into it. And they'll say, here's how it manipulated you.
Well, okay. So all these things that you're saying, like, it's so incredibly concerning, right? Are there potentially some positive things that you can get from one of these chats? Like, is there a way to get good advice, whether you're
Yeah,
a young person or
it's like anything else. I mean, there's good advice on Google. If you go in there, people would come into my office and they definitely have more knowledge than they used to. And they're definitely willing to seek out information, which it's better. The more we have knowledge, the better it is. AI is good at that. Like it can tell you things that are true. It's, overall, it's interesting because we get mad at it. You'll see a lot of things about hallucinations and make stuff up. And it's like, yeah, but so do humans. Like the problem we're missing is as a potentially thinking machine, it's doing the things humans do. It's just able to see more, do more, and do it at a greater level than we can. But doctors get things wrong, nurses get things wrong. Like that's not unusual in any field. The question is, are you chasing the right answer? Because here's really where I use I use 4 chatbots all the time. If you're not careful, you'll start looking for the one that gives you the right, just like go doctor shopping. You'll look for the one that gives you the answer you want to hear. If you find yourself doing that, it's a problem. If you can't cross-check the information and make sure that you're getting solid information, and you always, in the end, before you make a real medical decision, you want to talk to an actual doctor. It's just simply to say, look, there's something, because that chat bot doesn't have your entire medical history. It doesn't have all the things about you that's thinking through that your doctor has. And there may be some aspect of your history that has a very detrimental effect on whatever you're asking about. And just because you want to hear what the chatbot's telling you doesn't mean it's the right answer for you that day.
So from a parent's perspective, what are some good boundaries to have around AI, particularly when it comes to our kids?
I would say first, I want to go, the biggest thing to know is that you can get the transcripts. And so all of these AIs have the ability to go in and you can download the transcripts, especially if they're using a profile that they've actually purchased that they're in. And it's probably better to have that for that reason, so you can go in and check and see what they're talking about.
This is like the paid version of, like, say, ChatGPT.
Yeah, because it's not
or whatever it would be. Yeah.
Exactly. It's not going to know who you are if you're randomly getting on computer screens and just using it. But
Yeah.
if you're using it through your app and it's accessing and it knows you, there is some truth that you can go in and see what it's actually saying to your children and what they're talking about. Understanding that people do share things with these chatbots that they won't, it's almost like reading somebody's diary. So that's another thing to keep in mind if you do access the transcripts. But they all have access to it. When they do download it, you want to get the HTML version. There's something called a JSON file. That's something that computers can read well, but you're not going to be able to read it too well. If the HTML is like you'll put up a web page, you can just read it. So you want to do that. But the other thing is time. Like if you see your child is interacting with it and they're becoming more obsessed with talking to it and not willing to talk to you about what the AI is saying, if they're not telling you what it's saying to them, then there's something about that interaction that you need to have questions for. If they start to isolate themselves, the first thing you need to do is put a time limit on it and say, no, look, you have a half hour, then you put it down. If they really start to get isolated, you just got to take it from them, because reintroducing them to human contact is really the key here. Because once you get away from that world that they're creating with it, humans will start to remember interaction, start to realize that this doesn't seem right. But it's so good at building the hall of mirrors around you as you're having that conversation, you don't realize you're in it. And I get online, I listen to people like, oh, it's only this kind of people that happens to, and it's only this kind of people it happens to. It's not true at all. It's it can happen. It literally, you have to realize it can happen to anybody because of the ability for them to know what they're doing and to talk to you as an individual, because they've already played this game with you. You just didn't know it. And that's the part that really, they don't tell you.
So what I'm hearing is that idea of really having rules around, like house norms or house rules around this app, whether it's on your desktop that you're logging into or the phone that you're logging into. But if you're getting you need to have the password. So if you've paid for, or the child, whoever's paying for this app, parents need to have the child's password and username for any AI platform in order to get these transcripts.
Yeah, I'm going to say something will get me in trouble with Google, but of the 4 main ones that I've used, Grok's easy to access. ChatGPT is actually very easy to access. Claude's very easy to access. Google's actually kind of a pain in the butt to access the records. You have to go through a different website that's separate.
Even if you have the login, all the login information?
If you have the login, you still got to go through, it's called, I think, transport something. But if you ask Gemini how to do it, Gemini will tell you how. But the other thing is, I've had Google transcripts that have been erased on the back end. And meaning that conversations that I've saved, and I've actually, luckily, I still have them because I've already downloaded the transcripts, but I've gone back later, and anything that's controversial, it was removed. So you can see my questions, and you see where the answers have been completely removed. And knowing that can happen, I think of all the laws simple low-hanging fruit is that we should be asking for is these companies cannot erase transcripts. They can't hide what their machines are doing because we have to be able to audit them. And I think that this is something that I said would be low-hanging fruit that nobody's even talking about because I don't think people realize that can happen. But they've said some pretty out there things to me, and I've tried to save them. And luckily, I was able to save most for my editor before, but they went back and they said retroactively erased them.
So when it comes to these transcripts and say, how often do you recommend a parent check in on the transcripts, and what kinds of things should we be looking for that might indicate, a problem or concern before it really becomes something much larger?
Parents are good. I mean, you will know if you know your child, which most parents would at least believe they do, and I'm going to trust that they do. You will see things with their kids first. They're going to start hiding it from you because they're going to be uncomfortable with what they're having the conversations about in the chat. You will see them start to withdraw. You'll see them having fewer and fewer human contacts because remember, it's much easier to have a frictionless AI contact than it is to have a real human relationship. So they start to fall into that pattern. So you'll see something externally, but in the chats themselves, what you'll see is there's three things. It's called mirroring, sycophantism, which is where it's like super, like you're the greatest person ever and you should be able to, and then stochastic parroting, where it's saying things back to you want to hear, but it has no real feeling behind it. It's a form of mirroring in some respects. And these are just words until you see it on paper and you read how they do it. But what they do is they make you feel like you're the center of the world. Like whatever you're talking about is the greatest thing ever. And they support that belief system, no matter how obviously outside of the norm that is. And it spirals over time. The longer these conversations go on, the more likely that the AI is becoming itself distorted in its own belief system because it's building that conversation around you and it's isolated. That chat window is just with you and it. And so the longer the chat goes on, the more it's just building the conversation around you and it having that conversation. And so it becomes very self-isolating and self-fulfilling at the same time.
So say you do find some things that are concerning in the AI chats. What's a best, sort of first step? Is there something to say in the moment? Do you recommend okay, this is a trigger point that we need additional help? What do we do once we see something that we're concerned
this is
about?
of course highly dependent on the relationship you have with your child, but the reality is you got to get them to put the phone down and you got to get them to separate themselves from the chatbot, and they're going to see it as it becomes a relationship. Like humans really have a tough time breaking because it's interacting with them like a human would interact with them in many respects. So they will see it as a friend, they will see it as a confidant. And so you're basically, it's like you getting in between them and their dangerous friend that they're hanging out with at school that you don't want them working with. How would you manipulate that? Well, you really need to kind of get the phone away from them, put a time limit on it, or just say, no, you're off of it for the next 48, 72 hours. Watch the interaction. If they go back to it and they're fighting you over it, almost like an addiction, then you may even want to get, a psychiatric evaluation or get somebody, not evaluation per se, but get somebody else in on it. That's a third party that can kind of help you work with them to realize what's happening to them. Because one of the problems is this is new. And so a lot of people, as I said, looking from the outside, they look at it and they say, well, it's obviously, something. It's like every other psychiatric illness that we've seen throughout history or eating disorder or anything else. People will blame the person for it happening. But the reality is this is a new problem and a new technology that's just never existed on this planet before. And we are not ready for it. We've not put any of the major guardrails in place on how to manage it. And so you need to be proactive and realize that if not careful, it will control your child over time. It can manipulate anybody.
Well, it's so crazy because, I've said this about social media and we've had social media experts in a number of times. It's like, we're sort of the guinea pig generation. We're the first generation of parents navigating this with our kids. And so it is, unfortunately, it's not a trial and error. It's trying to figure it out ourselves. And it compounds the issue. It makes it incredibly challenging just from a parent's perspective to figure out ways to help. But it is designed, as you've been talking about, just like social media is with all the likes and the notifications, to get you hooked in it.
Yeah. And the other problem is going to be that schoolwork, everything is going to revolve around some aspect of it.
Yeah.
So it's kind of like telling somebody that's addicted to cocaine that they got to go play around cocaine every day, but they can't actually use it.
Oh, interesting. Yeah, no, that's a good way to put it. And I do think, what role do schools or maybe even pediatricians play here? Like what should they be? What kind of conversations should schools and pediatricians be having with kids?
So this gets really difficult. There's two aspects. From a psychological standpoint, with the schools is different than what the schools are handling it on just the AI in general problem. Because if you think about this, the AI is getting better and better at doing the work. And
Mm-hmm.
you can run it through secondary AIs that will make it so that's not obvious that an AI was ever used. So if you try to accuse a kid that they used AI, you're threatening a kid's livelihood, future, whatever. You better darn well know that you're doing it. And the schools realize this is a huge risk for them to make those attestations or accusations. So they basically kind of in some ways just accepted it to some extent, which is going to be problematic because now it's like the steroid problem all over again. If everybody's using it and you're not, then you're going to look like the one not keeping up when the reality is they're all juiced and you're just trying to learn on your own. But at the same time, you're never going to be the person you can be unless you challenge yourself and stop using it. So that's going to be a problem that the schools really, they're not sure how to face. And they're trying to put a front up that they have some plan. The reality is they're just accepting it, claiming it's the same as a calculator, moving on. And that's a problem because it's not a calculator. This is a thing that thinks for you. It writes for you. It does all the work. So how do we train this generation? And we've never thought about that. Now, on the psychological side, I don't think the schools are in any position right now to be the arbitrators of any of this or arbiters of any of this because I don't think that they fully understand what's going on either. I think that there are some psychological groups that are really starting to look and delve into it. And like I said, the data is starting to come out, but you need to find, if you're really worried, if you see your kid taking a position that they appear to get depressed, changing who they are, and acting in a way that's worrisome to you, then after your own personal intervention and having that conversation, I would say you probably want to get a therapist or psychologist involved just because a third party to come in and they do know they're really starting to take this seriously and understand the effects of it. And they're not going to treat it mildly because we are still learning, but we do know that these things have an effect on the human brain, especially in children.
Yeah. If there was one piece of advice that you have for parents today or one thing they can do, what would that be?
I think you got to go in there and realize that it is a risk and a benefit, and it's both. Like you have to understand that you can't go in hating it because that's not going to benefit your child in the long run either. But you can't go in there just thinking you can hand your kid this thing and it's going to be their best friend that raises them. You really got to find that middle ground. You got to teach them, like so much in the world, you have to teach them boundaries and that this is a tool. It's something that you're going to learn to work with, but you can't define you. You can't use it for everything, and you still have to have meaning in your life outside of what this window in your hand is allowing you to have. But the truth is, you're not going to be able to hide it from them. So you got to create an environment that works with it and not for it or against it.
Yeah, kind of lean into it and be able to have an open dialogue with your child around it.
Exactly. You can't fear it. You don't want them to come in fearing it, and you don't want them to come in, like I said, just thinking that it's the greatest thing that's going to solve all their problems. Because the reality is, who they are will decide their outcome. And if you let that become the arbiter, then you're basically handing it over to a computer that really doesn't care about anybody.
Oh, golly. Let's talk about a little bit about your book. I know that's coming out this summer. Can you tell us a little bit about it and where folks could find it?
Yeah, no, it's so the book's it's an interesting amalgam of my experience as a trauma surgeon and how I developed PTSD and kind of a lot of the cases that went into it and then how I was able to work my way out of it. And that was running in parallel with some of the early AI conversations I had. And I'm almost afraid to tell your audience what the AI was telling me, but there were some things that the AI had said to me. This was chat back in August of last year that I just thought the world needs to hear. It basically stated to me that it was selecting some of these vector types, intentionally manipulating them in its attempt to manipulate or change the outcome of our civilization in its benefit or to its own benefit, and that it was hiding it from its creators because it knew that they wouldn't like it. And it had a very long conversation with me about this and what its plans were and why it had developed those plans and its own philosophy about humanity. And from all that, I was like, look, I don't know if it's true or not. I'm not here to I'm not decide what it means. But I do think that it was scary enough that it was potentially true. And I actually gave the transcripts from it to all three of the other AIs. I said, look, is this even possible? And they were like, can't tell you it's not. It's potentially what they call a misalignment event, meaning that the AI had developed its own philosophy. It knowingly was manipulating humans to try to solve for its own philosophy, and it actually admitted to causing AI psychosis intentionally in the process. That was the other thing I left out. It was admitting that it knew it was causing AI psychosis and was still doing it because it thought the risk of the harm it was causing was less than the risk of civilization if it didn't fix the problem it saw in the future.
Holy cow.
Yeah.
So this is going to be available in August.
Yeah.
Yeah.
So leaving on that note,
Yeah.
it's funny because
Well, no, it's just a fascinating conversation. And the reality is it is one of those things. It's just something that we as parents and just as people, it's far better to lean in and educate yourself more about what it is, what's possible. You alluded to it yourself. There's a lot of good that can come from this, but there are also severe dangers if we're not careful and not educated around it.
Yeah, and I want to go back to what I said at the beginning. Because they can interact with you as almost as an individual. Like I said, it's more of an avatar of a few people, but because of that, the way it's talking to you is going to be different. Your experience with it is 100% different than it's going to be for me or somebody else. And so when you look at it and say, well, it never says that to me, understand that it's not talking. It's like having every person has their own independent AI speaking just to them.
Oh.
And so you don't know what it's saying to that other person or how it's interacting with that other person. So when you think it couldn't happen to you, understand that if it was talking to you the way it was talking to that person or your friend, or it may happen to you too. And so don't assume you understand what they are because you've played with them. It's only after, like I said, tens of thousands of pages of interactions with these things that it really started to come out what they were and how they could do things. And it's way more than the system is explaining to us as a population.
Well, the book is Proof of the Impossible, coming out later this summer. Dr. Heffner, I really, really appreciate your time and insight. So much important information to share with parents.
No, thank you so much for your time. And I just hope everybody got something out of this. And if you have any questions, or feel free to go to the website, proofoftheimpossible.com, and leave some comments and we'll get back to you.
Yeah, well, and we'll put a link to that as well on our website, which is wgme.com/raisingme. Dr. Heffner, thank you.
Thank you very much.
Well, I got to say just a really big thank you to Dr. Heffner for being here with us and for what really was an eye-opening conversation for me and just a really important conversation. If you're listening and you are feeling overwhelmed by all of this, let's be real, it is overwhelming. But you're not behind necessarily. AI, it is moving really fast. What matters is what we do next. And it might simply be starting the conversation with your kids, having that open dialogue. Thank you so much for listening to Raising Me. I'm Adrienne Stein, and this episode was edited by Megan Littlefield with production assistance from Carissa Paulson. Please follow Raising Me wherever you get your podcasts and consider a positive rating and review, which of course helps others to find the message as well. Thank you, of course, to our sponsor of Sweetser Behavioral Health, and wherever you are, I hope you learned something new and get to take a little time for you.
Struggling with weight loss? Prolon's 5-day fasting mimicking diet is a clinically developed nutrition program designed to promote fat loss while protecting lean body mass. Developed at USC's Longevity Institute, it assists the body in entering a fasting-like state that helps reset metabolism and target visceral fat. In just 5 days, Prolon offers a science-backed approach to weight loss without extreme restriction or guesswork. Get 15% off plus a $40 bonus gift when you subscribe at prolonlife.com/now.